Hello everyone, my name is Riya Datta and I am a health coach at Besugarfit. So today we will be talking about an important topic which is diabetic ketoacidosis. Now diabetic ketoacidosis occurs when the body cannot produce enough insulin to convert all the sugar in the food into energy. This creates a deficit of energy in the body. Our liver then fulfills this energy deficit by processing high amounts of fat into energy. The byproduct of this process is ketones, which are then released into our bloodstream. When the acid levels increases, the blood becomes acidic and the condition is diagnosed as diabetic ketoacidosis. Diabetic ketoacidosis, if not treated on time, can cause serious health complications such as organ damage, stroke, coma, or even death. It is important to seek the correct diabetes ketoacidosis treatment to prevent this. If you are at the risk of diabetes, you should always be on the lookout for symptoms of diabetic ketoacidosis and seek medical care immediately. With timely diabetic ketoacidosis treatment, diabetic ketoacidosis symptoms often develop within 24 hours. Some of them are excessive thirst, frequent urination, stomach pain, nausea and vomiting, shortness of breath, a dizzy feeling or confusion, weakness or fatigue, fruity smelling breath, dry skin, unconsciousness. People with diabetic ketoacidosis experience 3 or more of the symptoms at a time. However, they often confuse diabetic ketoacidosis symptoms with that of common diabetes. At such times, you should seek immediate medical treatment if your blood sugar levels are higher than usual and not responding to home remedies. Second, you are constantly vomiting and unable to keep down solids or liquids. Third, you experience fruity smelling breath. Fourth, you at home ketone kit indicates high levels of ketones in your urine. Fifth, you feel dizzy or confused. Sixth, you are having difficulty in breathing. Having type 1 diabetes immediately puts you at the greater risk of having diabetes ketoacidosis. If your sugar level reads or comes above 240 mg per dl, you can use at-home ketone measuring urine strip or get a blood test done. High levels of ketones are an indication of diabetic ketoacidosis. Diabetic ketoacidosis can cause organ damage, coma, or even death if not managed properly. Therefore, it is important to diagnose the condition at the earliest and receive timely treatment for the same. There are many treatments currently available for diabetic ketoacidosis management. All of them require a trip to the emergency room or hospital stay. Most of these treatments will help stabilize your blood sugar levels by normalizing the insulin levels. Here are the top 3 diabetic ketoacidosis treatments. First is fluid replacement. Fluid replacement is a common diabetic ketoacidosis management technique that involves replenishing the body with fluids intravenously. This is to make up for all the lost fluids in the body because of vomiting and excessive urination. Dehydration is another major cause of the rise in blood sugar levels. Replacing fluid in the body restores blood flow, reducing the ketone levels in the blood. It also helps dilute the excess sugar in the blood. Once your blood sugar levels have been normalized and there are no ketones found in the urine, you will be discharged. Second treatment is electrolyte replacement. Another method for diabetic ketoacidosis management is electrolyte replacement. It is used to replace the lost electrolytes in the body. These electrolytes have rather important functions in the body. These are electrically charged minerals that carry sodium, potassium, and chloride, which are required for the heart, nerves, and muscle cells to function normally. Lower levels of insulin in the body cause a drop in the level of electrolytes as well. In the case of diabetes ketoacidosis, this will be administered through intravenously. In the case of diabetes ketoacidosis, your doctor may put you on an insulin IV or intravenous until your blood sugar levels fall between 200 to 250 mg per dl. Normalizing the insulin levels in the body will directly reduce the ketones in the blood. Once there are no traces of ketones found in the body and your blood sugar levels are normal, you will be discharged. Furthermore, your doctor may advise you on various methods of diabetic ketoacidosis management to prevent such episodes in the future. Diabetic ketoacidosis is common in people with any of the following conditions. Those are type 1 diabetes, a recent injury, accident or trauma causing problems in the blood flow in the body, then a stroke or a heart attack, eating disorder, alcohol or drug abuse, pancreatitis. The first step towards diabetic ketoacidosis is to check the levels of ketones in the urine. If you have been diagnosed with type 1 diabetes, you should have a supply of ketone test kits handy at home. You can use this to check your blood or your urine for ketone levels. It is recommended to conduct a ketone test at home if your blood sugar levels exceed 250 mg per dl. 2. You are vomiting and feeling dizzy. 3rd, you experience fruity breath. Now, how to use a ketone test strip at home? Ketone urine test strips help indicate the level of ketones in the urine by changing color. The strip will change color once you pee on it. The test kit will contain a result chart. Compare your results with the chart to understand the approximate amount of ketone level in your urine. There are blood ketone test kits also available to help you with diabetic ketoacidosis diagnosis. These will test both your sugar as well as ketone levels in your blood. It is easy to prevent diabetic ketoacidosis complications by keeping your blood sugar levels in check and acting immediately if you notice any of the above mentioned symptoms of diabetic ketoacidosis. Here are a few ways in which you can lower your risk of diabetic ketoacidosis. Number 1. Never skip your insulin shots. 2. Follow the diet plan given by your nutritionist or dietitian. 3rd, be consistent in checking your blood sugar levels. 4th, check for ketone levels in case you notice any signs of diabetic ketoacidosis. Managing diabetes ketoacidosis is quite easy if you inculcate healthy eating habits in your daily routine and strictly follow a diabetic-friendly diet. It is always advised to consult your doctor and avoid self-medicating or increasing or decreasing the dose of insulin that is recommended to you, as it can harm your health. A good diet, an active lifestyle, and following your doctor's advice can help you effectively manage diabetic ketoacidosis. Thank you.